So a health and wellbeing coach is somebody that is trained to help patients to take control of their health. What we aim to do as a health and wellbeing coach is to help facilitate and empower patients to really take control of whether they're dealing with chronic diseases or whether they want to look at prevention and trying to prevent chronic diseases, or even help with their mental well-being. So a coach is somebody who can really facilitate people in understanding what's going on in their lives, really align with their values and create really positive, actionable goals that will help to create fundamental changes that will help them to really live happier and healthier lives. Health and wellbeing coaching can encompass all areas of life, and what we aim to do is help people take a very holistic approach when we look at people's health and well-being. So health and well-being coaching might be associated with people who want to help with their chronic diseases such as diabetes or heart disease or blood pressure or even autoimmune conditions. But it could also be people who are struggling with things like anxiety and stress and depression, but also generally people going through issues in their daily lives, such as their relationships or work and school and things like that. So health and wellbeing coaching can encompass all different areas. So as a health and wellbeing coach, I aim to help people really understand the root cause of their problems, of kind of, their chronic diseases or what they want to gain from whether they want to look at prevention and improving their lifestyle. So the process involves using coaching techniques to help people look at the changes that they want to make, and really help to put actionable goals in place, whether it's to do with lifestyle, whether it's to do with nutrition, whether it's to do with their mental health and issues that are going on. Really put in key fundamental changes that help them to change their thought processes and their behaviours that lead to long-term sort of sustainable changes, and really help people now feel better in control of their health and well-being. So with health and wellbeing coaching, it's making fundamental changes to the way we look at health and wellbeing, and this is really empowering for patients. If we can help patients to understand what's happening as a root cause of their underlying illnesses, and moving away from over-prescribing as we often do, and really helping people to make those fundamental changes. And we can help people to look at their nutrition as a form of medicine, their lifestyle, their physical activity, and really make these changes that now help them look after their health better, so that they are better equipped for the future. They have the tools, they have the confidence and the motivation now to do these changes on an ongoing process for the rest of their lives, and hopefully can then either, if they're dealing with chronic diseases, lower the burden of these chronic diseases, or even reverse diseases in some cases, and also help to prevent them for the future so that they can live longer, happier, healthier lives. Okay. Coaching can last anywhere between one session, if, for example, if somebody has a particular issue that they want to deal with. So, for example, an issue dealing with some stress or anxiety, or it could be a few sessions if people want some help with looking at weight loss, or even up to a kind of a full overall lifestyle plan that would be up to about 12 weeks.